Hey guys, Julie here with Birmingham Mom Collective, and today we're talking with UAB Medicine all about urogynecology. And today we're here with Dr. Powell to talk about this great subject. Hi, Dr. Powell.
Hey, good morning, everybody. Thanks for having me, Julie.
Good, good. Okay, so first off, just tell us a little bit about what you do at UAB.
Well, um, I am a urogynecologist, as you said, and not everybody knows what that means. A urogynecologist is essentially a urologist for women. You can do what I do as a medical provider, either from a urology background or from an OBGYN background. I personally come from an OBGYN background and did subspecialty training so that I could help women with specific urologic issues and I care for a wide range of conditions and a wide range of patients.
Great. Okay, so let's talk about the difference. You came from that OBGYN background. What is the difference between the gynecologist and the urogynecologist?
Yeah, absolutely. Our GYN colleagues tend to focus a little more on female primary care. They obviously have a broad range of surgical skills as well. But over the past several decades, there's been a recognition that there's increasing need for subspecialty surgeons and subspecialists who take care of women for pelvic floor disorders of various types, and specifically for urologic issues such as incontinence.
Okay, great. So, how would a person know, or when would they seek out treatment from a urogynecologist? Talk about some of those symptoms, some of those signs that they would be seeing.
That's a great question. A lot of patients will come to me via a referral from their general OBGYN or from their primary care provider. But I do get a lot of self referrals, and some of the things that people will come to me for would be things like pelvic organ prolapse. Women who feel lots of sensation of pressure or vaginal protrusion, or just changes in their anatomy and need to be counseled a little bit on what those changes mean, what treatment options are available. And then, in addition to those pressure and prolapse symptoms, often urinary incontinence is a discussion that we have a lot. And I know that that's something that we don't always sit around the dinner table and talk about, but it's a really big quality of life issue. And I think women deserve to know that there are really good treatment options out there for them, both surgical, non-surgical. And I really see myself as somebody who spends a lot of time providing information and just giving people the lay of the land of these are our options. This is a plan we can work on to improve your quality of life.
Yeah, awesome. We actually talked about pelvic floor in our last topic with UAB Medicine. So if you want more information about that, be sure to check out that video as well. But that seems to be an issue that a lot of women experience after childbirth. And there are some great options out there that I don't know if women might not know that there's some things that they could do and they don't have to live with that going on. Okay. Yeah, for sure. Are there any clinical trials going on for patients?
There are, and I think that's something we pride ourselves on here is that we focus very much on the individual person who's in our office. But sometimes the best way that we can provide them with the most options is to have the most up-to-date clinical care that's based on research, but also to be on the forefront of that research as it's being done. So we do have several trials ongoing, both in the realm of surgery for pelvic organ prolapse, as well as medical and surgical treatment of urinary incontinence. And so I'm really pleased that we have those resources for our patients, both in established clinical care and also sort of on the horizon as things develop.
Absolutely. We are extremely blessed here in Birmingham to have UAB. And I know that firsthand. I've had lots of relatives and family members there, and the quality of care and the amazing doctors they have there. We're just very blessed here that it's right here in our city. Talk about some of the average age of women that you see. Is there, is it more older women? Is it women of all ages?
Yeah, that's an excellent question. So I would say that the majority of my patients are somewhere in their third to eighth decades of life. So it's a wide range.
Okay.
Sometimes it skews a little more to the 5th to 7th decades of life, but it really can be anybody. And I think that's something that is worth a conversation just in our society, is that women don't have to wait until
Mm.
they're in their 6th or 7th decades of life to seek treatment for prolapse or pelvic floor issues or for incontinence. These are things that, even though we don't talk about them all the time, they really can affect people of any age, and that there are viable ways to make it better, regardless if someone's in their 30s or in their 80s. And so it's a really important topic when it comes to raising awareness. And so I really appreciate that you're helping us do that.
Yes, absolutely. I would say, as a mom in her 40s, I keep thinking, well, I'm so busy right now. I'll just put it off and I'll do it when I'm older and my kids aren't young and I can have a lot more time. But would you say it's better to come in earlier then?
I do hear that a lot. I have a lot of people who will say, "I can't believe I waited so long," and then other people who come in and ask that exact question: "Is this the time in my life when I should be considering these things?" And the thing I think I would say most strongly is that if there's something that's on your mind, or if there's something that's bothering you, it's never too early to at least have a conversation. Um, uh, Something that's really important to me personally is that no one ever feels pressured to choose a treatment plan, um, and that I can partner with them. And I think everyone in our group would agree that our best management style is partnering with our patients to find what works for them. And for some people, that's moving into a more aggressive treatment pattern. For other people, it's sitting and having a conversation about, is this the right time for me to think about a surgery, or is this a better time in my life where some of our non-surgical treatments are worthwhile? So I would say it's never too early. There's always something that can be done, even if it's just having a conversation and getting someone some education about what's going on.
Awesome. Thank you so much. So if there's someone out there today who would like to visit your office and learn more about the options they might have, how would they get in touch with you guys?
I'd say the best way to go about it would be to go to uabmedicine.org, and then in the top right corner, there's a make an appointment button. You can search for urogynecology. You can see all of the providers that we have, and then we look forward to meeting anyone who has a need for our services.
All right, great. Well, thank you so much, Dr. Powell. We appreciate your time today. And thank you so much for watching. We hope that we can help a lot of moms out there in Birmingham learn more about the great services that they offer at UAB. And we'll see you guys next time. Bye.
Excellent. Thanks for having me.
Thanks.